Well, welcome everyone. My name is Elaine and I'm helping Dr. Park moderate today. Before we get started, I just want everyone to know Dr. Park's going to be covering a lot of really good information today. So if you have any questions that come up along, please feel free to enter them into the Q&A section on the Zoom. And then at the end, we'll read them to Dr. Park to address. So without further ado, I'd like to introduce board certified plastic surgeon, Dr. Park.
Thank you, Elaine. So definitely want to thank Elaine and her company Fast Track Marketing, who's been sponsoring and helping us deliver this, as well as Dan, who is also one of my webmasters, of course, Yvette, my office CEO, and exciting to continue this series. And there's been a lot of good feedback from all of you. And happy Friday, everyone. And it's great to join you guys on a Friday and also a new year. I want to start off saying definitely a happy 2021. We've all been been challenged with various things, both personally and with a new president, all of this, but a new year. And it's exciting. We definitely want to focus this as a new year for a new you. And, that's one of the goals that I definitely wanted to do, even for myself, is to really give yourself a lot more credit and more focus. This is kind of a year of transformation. We've all been suffering from the COVID bodies. And so our practice is doing a fitness challenge, and we encourage you to join. And we definitely have a lot of positive things going on for this year, but we are going to be focusing on mommy makeovers. If you've seen some of my previous talks, this is definitely going to be a little bit of a combination of what I have focused on. But mommy makeovers are really kind of probably one of the most popular procedures that I do. And I've always been inspired by all mothers. You guys literally take care of everything, almost everyone. I know my wife, who is my hero and who keeps everything together, not only at home with our 4 kids, but also at work. She is everywhere and anywhere. And I think all mothers are so inspirational, and they sacrifice you all sacrifice so much of your time, your energy. And so this is a moment where if you're a mom, you're in the right place to listen, but to really give yourselves kind of a gift to oneself. Because what most people don't understand, even fathers and husbands, we don't understand the physical sacrifice that a mother gives when their body is going through pregnancies. So I've always joked that when you get married or you have a baby, it should be in the contract that you deservedly are given a mommy makeover. Every mother deserves one, even after one baby. So what is a mommy makeover? We're going to focus on quite a lot today, and we'll try to kind of go over the salient points. But essentially, we're targeting 2 areas. Usually on the top, it's a breast augmentation or lift/reduction. We're definitely going to focus on the tummy as far as kind of the growth and spreading of the layers of the abdomen, and then some supplemental liposuction. So those are kind of the 3 areas that we're looking at. And so, there's a question that I commonly get is, do we or shall we do all procedures at once? And oftentimes the short answer would be yes. So if you're thinking of the breast and the tummy, we're looking at these 2 parts of the core of your body as balancing upon one another. And so that's very important because, for example, if you have enhancement of the nice breast and we're still having a large waist, well, that's going to not look as nice as if we have that hourglass silhouette that we're trying to create in the core of your body. And it's also safer in terms of one recovery rather than having to, as well as having one aesthetic anesthesia rather than having 2 anesthetic procedures. So if we can, in the ideal situation, we definitely want to do a combined mommy makeover procedure. So it's never nice to ask if anyone's pregnant. You got to make sure. But this is the growth. And if you can see, we're looking at the breast and abdomen. Those are the primary areas that have been stretched. Again, looking at all layers. So focusing on what is stretched specifically, these are the two areas. Once again, the breast, the skin, and the breast tissue get stretched out in terms of volume, as well as, of course, the abdomen. When we're looking at the tummy, here's a really good example of a lady doing a plank, and you can see that she's got this, she's in great shape and she's fit, but she's got this muscle protruding here when the laxity of her abdominal wall, her rectus muscles have separated from pregnancies. So we see that separation of those abdominal muscles in almost every single mother. And so this is kind of the most important part of the restoration of the abdominoplasty. So again, we're going to stretch out in the baby part of the abdomen, and sometimes the breasts will sag over time and through pregnancies. Now, in terms of the breasts, pregnancies will affect the skin elasticity. You've got the breastfeeding, the engorgement of the milk, stretching everything out. You've got hormonal changes, gravity, and some people are not wearing a bra all the time, so the gravitational effects can really pull on the breasts themselves. So this is probably one of the most telling diagrams that I like to share because it's so visual in terms of how the muscles separate. Now we look at the first diagram where there's no separation. We're got this nice tight six pack. And at 9 months, you see this drastic spreading of these rectus muscles. And so this is that what we call diastasis recti, where we have separation of the muscles. And this is probably the most important part that I'm very aggressive in correcting. So once again, this red circle is where we really, really want to focus on. That is what's going to give you that hourglass figure when I do that abdominoplasty procedure. So here is a quick diagram of showing what is done anatomically. So we're suturing together. I'm suturing these muscles together very aggressively. And you can even see the contour where we look a little square here. And now we're tightening the middle right here where that green arrow is showing that reduction of that waistline. We're contouring that waistline very aggressively in order to get that hourglass silhouette back. Again, in an evening gown or a bikini, we really want that hourglass silhouette. So very quick, not that we're too interested in anatomy, but basically we're incising around the belly button, pulling down the skin, plicating the muscles, and removing all that extra skin. So skin removal, muscle plication, which is corseting the muscles together, and then we'll supplement liposuction on the sides, which is kind of the flanks. So this is a good picture demonstrating how on the abdominoplasty in front, obviously we've got great hourglass figure, but you can see the bulges on the side where from the back view, this needs to be liposuction to give us a really nice 360-degree silhouette, not only from the front, but from the back as well. So we've got this nice hourglass there. So liposuction is the adjunct to the abdominoplasty procedure. So some of the things that I've talked about in the past, but I think are super important, what sets me apart is number one, the incision location and the umbilical scar have to be done perfectly. And I think that's what you'll hear about a lot of my abdominoplasties is they have to be hidden very, very well. The other thing that's important is I use a no pain and no drains. Most surgeons use drains, but I've developed a technique to eliminate drains by using contouring sutures. And so we want, for example, this is an example of a really not so good scar. It's a little too high. You've got a wide belly button scar. And these are, we don't want to show this type of a scar. So we want scars to look on this portion on the right very low and hidden and faded. And the belly button scar really, really, we desperately try to hide that inside. So that's very, very important. It's also important to keep this scar low so that we see a nice pubic lift. And so we want that pubic lift to flatten that area as well. So that's very, very important. As we move on, everyone has a different kind of subjective idea of a beautiful belly button. Here are some of them, but it's important to have a little slight hooding on the top there and to once again make it look natural with no scarring inside the belly button. So that's a very, very important telltale sign. How do I do no pain and no drains? Well, number one, I'm putting what are called tension sutures all along the abdominal skin flap to tack it down to the muscle wall. This is eliminating space, no fluid, no drains. So again, makes a lot of my patients heal a lot quicker. They are up and about very quickly. And also I'm injecting Exparel, which is the pain medication, into the muscle walls to really help with the first 48 hours of the pain there. So those are things that have made recovery of my patients a lot quicker. Now, when we're looking at the breasts, there are various areas where the lower half, if we look at the breast and we're looking at the lower half and needing to lift it, then we're really going to look at kind of this, what we call a lollipop or a vertical breast lift. And what that's going to do is lift the lower pole of the breast up off of the rib cage. So if after pregnancies and breastfeeding, you've felt that the breasts are laying on your ribs and are a little too low, then we want to lift the lower pole up. Now, oftentimes that's not enough to give volume and cleavage. And so I combine an implant, which is going to go under the muscle as shown in this diagram here. And this part right here along the midline is what the implant is designed to give you nice upper pole cleavage. So once again, there's often a two-part correction in the breast where we need to lift the lower half of the breast and then place the implant behind that lifted breast under the muscle in order to give you that really nice full cleavage, upper pole fullness. So we're going to jump into kind of results right here and in a moment. One of the things that I think is very important also during surgery is I'm always checking and sitting the patient up. People often wonder, how do we get the check for sizing and areolar placement, etc. This is important to sit the patient up, try on the sizers and the implants to make sure that we have precision in terms of the size and the placement of the implant, as well as the breast lift, which is being shown right here. So a lot of people also ask about recovery. And in terms of the recovery, I basically use kind of a 2-4-6 week rule. And again, this is both for the breast and tummy combined in terms of procedures. At 1 week, a lot of patients are certainly able to get back to work from home or desk work. That certainly can be done pretty quickly. Also around this time, closer to 1 to 2 weeks, should be able to drive, maybe do some light activity, light errands and such. Letting my patients do a lot more walking at about 4 weeks. And then finally 6 weeks, you're able to hit the gym and go full force there. Heavy lifting, running, all of that. So we're just going to jump into various results right here. This is a patient of mine. We did a mommy makeover, a very standard procedure whereby you can see that her lower pole breasts are resting on her ribs here. So again, to lift this lower pole upwards, we see that now she's a lot more rounded here. And then the implant is going to fill that upper pole and give that nice natural cleavage. A lot of people ask about the scarring here. The vertical scar on the lower pole of the breast disappears very, very nicely on almost everyone. And I'll show you a 1-year result. This is a 3-month photo where we are going to see some scarring, but it will fade out after 1 year very, very nicely. We can see that with the tummy, the skin has been removed, and we can see some etching here and contouring. And this is because of the muscle plication sutures, as well as the contouring sutures that I place. Now, this is a really nice example. Exact same surgery. We're doing a breast lift, a tummy tuck, and liposuction to the flank or the kind of the muffin top area. You can see the contour is beautiful here. We're trying to restore that hourglass figure. And what's nice is this patient is actually one of my 1 year results. And what's nice about that is after 1 year, we talk about that. I challenge anyone to find that scar in that lower pole. So that's a really nice result in terms of that. This is just another breast lift photo. Again, showing that we really want to get that lower pole off of the rib cage, and that's very, very important there. Once again, showing that kind of a result with a lift, and then thinking that the upper pole, like how much cleavage do we want? Well, that's determined by the size of the implant. So if we want more cleavage, as in this case, versus on the right, very natural, that's going to be a smaller implant. So continuing on with a few results, again, this is an example of really, really contouring the abdomen. And what we're trying to achieve is kind of this V shape in the upper pole here, and really giving that hourglass figure in just the abdominoplasty procedure part. And even from side views, again, just really concentrating on that silhouette there and getting that hourglass figure. I like to show this picture on the left because this particular patient is obviously very, very thin. I think she weighed just around 100 pounds. And you can see that even in this case with several pregnancies, her muscles are just really damaged and separated. So again, the most important part to get that hourglass is aggressive corsetting of the muscles back together to get this hourglass figure. She went with a straight augmentation here to give her that nice cleavage. And we've got kind of that body back, that youthful appearance. Finally, just a few more. We've seen this one actually. But again, showing the difference between the lift here. Again, things are kind of a little bit healing here at 3 months. But again, the 1 year result shows that the scar and the rippling. I do get a lot of questions on rippling. This is a good example. At a couple of months, there might be a little bit of rippling in the skin from the repair, but that will always go away. So that's very important to be patient on that end. So that's pretty much the conclusion. I appreciate all of you definitely participating and taking a part. And I'm going to hand over the microphone to Elaine.
Yes, so we have lots of great questions. So I'm just going to dive right in. So first up, kind of a two-parter here. How can you take care of the scar during the healing process, and what can you use to help lighten the scar up?
Yeah, that's a very good question because what's most important to note is that scarring is different on different parts of the body. As an example, when I'm doing a facelift or an eyelid lift, those scars in the face disappear in about 3 to 6 months beautifully. Now, breast scars actually heal very, very nicely as well. So that vertical scar that a lot of people see on photos, confidently they'll disappear very, very nicely and don't need to do too much. Now, abdominoplasty tummy scars, they take a while and sometimes will not fade all the way. So I do recommend doing scar treatments there, of which I like silicone strips. And I tell my patients, even on Amazon, you type in silicone strips for scars and you place those on the scars, and that helps compress the scar and deoxygenate the scar so that we don't get that raised pink scarring. So silicone strips are great. Other scars, any over-the-counter works okay, like Mederma as well. But really, it's just designed for your genetics. That's more important than anything.
Perfect. Another question, can you get lipo on any other sections of your body while you're getting a mommy makeover?
One more time.
Can you get liposuction on any other parts of your body while you're getting a mommy makeover?
Correct. So oftentimes, routinely, when I'm doing a breast and an abdominoplasty procedure, with the abdominoplasty, I'm almost always liposuctioning the back, as we saw in this particular patient right here. So that is an area that I'm always doing liposuction. Now, there's also other areas that are very, very common that some people will add. For example, the upper back and the side breast is a very common area. So if that's an area of concern where a woman wears a bra and it cinches in and there's fat in that area, then yes, we can add liposuction to those areas as well. The second or third area that's commonly asked is about the thighs, the inner thighs and outer thighs. So just depending on where the patient is focusing on, I certainly can add that to the procedure as well.
Okay, awesome. How much time is recommended after a tummy tuck to wear a girdle?
So good question. Generally, I like compression for the abdomen or liposuction for an average of 6 weeks. So we placed a patient in a Velcro abdominal binder for the first 4 to 6 weeks. And based on patient swelling, sometimes if someone has a little bit more or less, if they're doing well at 4 weeks, we can transition them to a Spanx. But at 6 weeks, I like to have them off of the binder so they can start engaging their muscle. Now they can still wear Spanx or when they're working out, like a shaper type waist trimmer in order to help with the swelling, because swelling does persist for 3 to 6 and even 9 months, just a little bit of that swelling. So, but compression garments on average about 6 weeks.
Excellent. Have you done surgery on a patient who has had COVID without any problems during surgery or during recovery?
So that's a very, very good question. So in this era, I'll have you know that our practice, we pre-op COVID test every patient for surgery. And I think that's very important. It's for the safety of the patient as well as the employees, everyone for that matter. And if a patient does test positive for COVID, then of course, we are going to postpone and delay that person's surgery until they are well and feeling healthy. So I won't operate on a patient that that is actively with COVID, but once they have recovered, then of course and healthy, then we can put them back onto the schedule there. Did that answer the question?
Yes. How about what if you've never been pregnant yet still need the mommy makeover due to age and weight loss?
Absolutely. So pregnancy is just a model of what I consider or what we look at as tissue expansion. What it really is about is weight gain and weight loss. So in the same category, if a person has gone through a tremendous amount of weight loss, for example, weight loss surgery, or even just losing weight on their own, they are also going through the physiologic changes similar to pregnancy. They've stretched things out through weight gain. And then when they lose weight, we still have laxity of skin and rectus muscle separation. So absolutely, I would treat them the same in terms of the fact that, yes, they can go over, even if it's titled as a mommy makeover, it's still an abdominoplasty to correct that weight gain, weight loss change. As well as sometimes I'll operate on the breast for even young females that have not had, but may be born with a saggier breast and still needs a breast lift or a combined implant.
Excellent. How soon before the procedure do I need to come in for a consultation?
Good question. Me and my wonderful patient care coordinators, we love to meet everyone on any platform. It's as easy as making a phone call versus a virtual consultation. But ultimately, I like to meet a person in person in the office. And that's where you and I will really kind of develop our relationship and for me to understand kind of your goals, your vision, and your dreams. Because oftentimes a mother or any patient will come in and they may say, well, I want to lose a certain amount of weight and I want to develop those goals to get them to their ideal weight prior to surgery so that they can get the best results. And so let's say a patient is planning a surgery in 2 to 4 weeks. I would love to see them right then and there. Some patients will see me 6 months before their goal. So anytime is a great time to establish and start that relationship with me so that we can define your goals and your vision.
Excellent. Is there a weight limit for surgery?
Great question. The most important thing is that I want my patients with elective surgery to be healthy. And part of that health is having a healthy weight. And what we measure is called a BMI. So it's called a body mass index. So the safest body mass index is anything, a number of 30 to 35 or below. So an easy way to Google this is you can Google body mass index calculator, and you simply put in your height and your weight. And so if someone is 5'10", of course it can weigh, a lot more than someone that's 5 feet tall. But the bottom line is we do want your weight to be healthy, below a BMI of about 35 or so, ideally. And that will give you the best healing results.
Excellent. How about, can an auto augmentation be done with a tummy tuck?
Absolutely. As a breast kind of expert, reconstruction and revisionist, I love the auto augmentation. And what that question is regarding is that if a patient has a breast where they feel it's a little bit low and we're going to do a lift. Now, if they have their own breast tissue volume and a good amount of it, what I'm doing is I'm moving that lower breast tissue up into the upper pole and suturing it there to serve as their own implant. So in essence, it's an auto implant of your own breast tissue that I'm mobilizing to the cleavage upper pole. Now, the caveat is they do have to have enough breast tissue volume in order to be a candidate. So we would discuss that on consultation and exam.
Great. If you have GERD, can you still proceed with a mommy makeover?
Can you repeat one more time, Elaine?
GERD.
GERD. Absolutely. So what that question is GERD, and that's gastroesophageal reflux disease. So basically some patients have reflux. Definitely want to know what level and how they are being treated for this. It's common for people to have reflux if they're on some type of antacid, but we definitely want to make sure that it's controlled and they have proper treatment for that before undergoing surgery. And that really goes with any medical condition, whether it's diabetes. I've had patients with high blood pressure, very common. And the most important thing is that it's well controlled with their medications. So high blood pressure medications are on board. The fasting sugars are below 100 in someone that's a diabetic. So even thyroid disease, we want to make sure, and we do pre-op labs to check and make sure you're in tip-top normal numbers for good health with those conditions.
Awesome. And I think we have time for maybe one more question. Someone wants to know how they find your office fitness challenges. Are they on your website?
Yeah, so that's a good one. We are actually in the process of rolling that out to our patients. Our office, I couldn't even thank my staff enough. I mean, they're the ones who I rely on to do everything that I do. And oftentimes we like to do fun things like a fitness challenge to motivate the team. But we will definitely, I'll talk with my team about having the patients involved, because I really, really want to get you guys involved. And it's just great motivation to do this type of thing together. So we will work on that and announce that shortly.
Excellent, excellent. Well, I know we're out of time here. So just to kind of wrap this up, I know we have a couple more questions. And I know a couple people have asked about financing and cost. Especially for cost, I would definitely recommend scheduling a consultation. Those are complimentary. You can also shoot us a text. Our phone number to do that is 909 981 8985. We will also be sending an email out this afternoon that will have the details to receive that discount for being a webinar attendee. It'll also have a link to schedule online for that consultation. So you can reach out and get any other questions answered through there.
Perfect.
Awesome. Well, thank you, everyone. Thank you, Dr. Park.
Yes, I'd like to thank everyone for spending your Happy Friday here. Definitely, I'm always available and I'd love to meet each and every one of you. Whether it's just through a consultation, please give me a call or even email, and would love to get you on your journey or answer any questions for that matter. We are all here for you. Ask for Desiree or Francis for any consultations, and we will meet all of you soon. Thank you. All right, Elaine. Thank you, thank you.
Thank you, Dr. Park. Very, very well, as always. Very good job.
Thank you. I kind of tried to talk fast there.
Yeah, you did good. That was perfect timing for the question. So very good.
Thank you all. If there's any more questions, feel free to send them to me and Yvette.
Absolutely, will do.
Perfect.
All right. Thank you, Dr. Park. Have a good Friday.
Thank you.
Bye.
Bye.